Do you want to successfully complete the D027 objective assessment exam? Then you are in the right place. Our website provides a list of questions and answers for your success in the D027 OA exam for free. We understand that acing your OA exam can be quite challenging. That's why we provide completely free exam guides and practice questions for you. In this video, we will cover questions from memory loss, asthma relief, blood disease, celiac diet, and viral rash. So, let's get started. 1. A nurse is caring for a patient with Alzheimer's disease who has difficulty remembering recent events but can recall childhood memories clearly. Which pathological finding would most likely explain this pattern of memory loss? A. Vascular occlusion. B. Nerve cell plaques. C. Metabolic dysfunction. D. Inflammatory response. Can you guess the answer? Correct answer, B. Nerve cell plaques. Explanation. Option B is correct because plaques and tangles are key pathological signs in Alzheimer's autopsy findings that cause nerve cell death and tissue loss, particularly affecting recent memory formation. Option A is incorrect because vascular occlusion is more characteristic of vascular dementia, the second most common type of dementia, not Alzheimer's disease. Option C is incorrect because metabolic dysfunction alone doesn't explain the specific pattern of preserved remote memories with impaired recent memory formation. Option D is incorrect because inflammatory response is not the primary pathological feature of Alzheimer's disease that causes memory pattern changes. Let's dive into the pathophysiology behind Alzheimer's disease memory patterns. In Alzheimer's, the brain develops two key pathological features, plaques and tangles. These plaques are abnormal protein clusters that form between nerve cells, while tangles are twisted protein strands inside the cells. The hippocampus, which processes new memories, is affected early in the disease process. This explains why recent memories disappear first, while older memories, stored in different brain regions, remain intact longer. The correct answer is nerve cell plaques because these protein deposits, along with neurofibrillary tangles, are the hallmark pathological findings in Alzheimer's disease that cause progressive nerve cell death and tissue loss throughout the brain. 2. A patient presents with wheezing, chest tightness, and nocturnal coughing that improves after using albuterol. What physiological mechanism best explains why this medication provides relief? A. Anti-inflammatory action. B. Mucolytic properties. C. Bronchodilation effect. D. Antihistamine activity. Do you know the answer? Correct answer, C. Bronchodilation effect. Explanation. Option C is correct because albuterol is a short-acting beta agonist that relaxes smooth muscle in airways, causing bronchodilation and providing quick relief from asthma symptoms. Option A is incorrect because albuterol doesn't have significant anti-inflammatory properties. Corticosteroids serve this function in asthma management protocols. Option B is incorrect because albuterol doesn't break down mucus. It works by relaxing airway, smooth muscle to improve breathing. Option D is incorrect because albuterol is not an antihistamine and doesn't block histamine receptors that contribute to allergic responses. Now let's explore how albuterol works to relieve asthma symptoms. Asthma causes the airways to become inflamed, swollen, and constricted, making breathing difficult. Albuterol belongs to a class of medications called short-acting beta agonists, or SABRs. When inhaled, albuterol binds to beta-2 receptors on the smooth muscle cells surrounding the airways. This binding triggers muscle relaxation, causing bronchodilation, the widening of the air passages. This rapid bronchodilation effect provides quick relief from wheezing, chest tightness, and difficulty breathing. The correct answer is bronchodilation effect because albuterol works by relaxing the smooth muscles in the airways. opening them up to improve airflow within minutes of administration. 3. A pediatric patient with beta thalassemia requires regular blood transfusions. Which medication would specifically target the underlying pathophysiology by increasing red blood cell production? A. Epitin alpha, B. Iron supplements, C. Folic acid, D. Vitamin B12. Can you guess the answer? Correct answer, A. Epitin alpha. Explanation: option A is correct because epitin alpha is erythropoietin that stimulates red blood cell production, directly addressing the reduced hemoglobin characteristic of beta thalassemia. Option B is incorrect because iron supplements could actually harm beta thalassemia patients who often have iron overload from frequent transfusions. Option C is incorrect because while folic acid supports red blood cell production, it doesn't specifically target the hemoglobin deficiency problem. Option D is incorrect because vitamin B12 deficiency isn't the underlying cause of beta thalassemia's reduced hemoglobin production capacity. To understand beta thalassemia treatment, let's examine the underlying blood disorder. Beta thalassemia is an inherited condition where the body produces reduced or absent beta globin chains, essential components of hemoglobin. Without proper hemoglobin, red blood cells can't carry oxygen effectively, leading to severe anemia. Regular blood transfusions help, but they don't address the root problem of insufficient red blood cell production. This is where epitin alpha comes in. It's a synthetic version of erythropoietin, the hormone that stimulates bone marrow to produce more red blood cells. The correct answer is epitin alpha because it directly targets the underlying pathophysiology by stimulating the bone marrow to increase red blood cell production, addressing the anemia at its source. 4. A patient with celiac disease experiences chronic diarrhea with greasy, bulky stools. Which dietary component must be completely eliminated to prevent intestinal damage? A. Lactose products, B. High-fat foods, C. Processed sugars, D. Gluten proteins. Do you know the answer? Correct answer, D. Gluten proteins. Explanation: option D is correct because celiac disease is an autoimmune condition where gluten ingestion damages the small intestinal epithelium, requiring lifelong adherence to a gluten-free diet. Option A is incorrect because lactose intolerance is separate from celiac disease, though some patients may have both conditions concurrently. Option B is incorrect because high-fat foods don't trigger the autoimmune response, though malabsorption may affect fat digestion. Option C is incorrect because processed sugars don't cause the autoimmune reaction that damages the intestinal lining in celiac patients. Let's break down the core concept behind celiac disease and dietary management. Celiac disease is an autoimmune disorder where the immune system mistakenly attacks the small intestine's lining. The trigger for this attack is gluten, a protein found in wheat, barley, rye, and sometimes oats. When someone with celiac disease consumes gluten, their immune system responds by damaging the intestinal villi, tiny finger-like projections that absorb nutrients. This damage leads to malabsorption, causing the characteristic greasy, bulky diarrhea and nutritional deficiencies. The only effective treatment is complete lifelong elimination of gluten from the diet. The correct answer is gluten proteins because these specific proteins trigger the autoimmune response that damages the intestinal lining, and avoiding them completely is the only way to prevent ongoing intestinal damage. 5. During a varicella infection, a child develops itchy vesicular lesions that progress through multiple stages. What intervention would be most appropriate for symptomatic relief? A. Ibuprofen therapy, B. Aspirin administration, C. Calamine application, D. Antibiotic treatment. Can you guess the answer? Correct answer, C. calamine application. Explanation: option C is correct because calamine lotion and oat baths are recommended non-pharmacological interventions to relieve itching associated with chickenpox vesicular lesions safely. Option A is incorrect because ibuprofen may worsen varicella lesions and is generally avoided during active chickenpox infection periods. Option B is incorrect because aspirin is contraindicated in children with varicella due to risk of Reyes syndrome development. Option D is incorrect because antibiotics don't treat viral infections like varicella. Antivirals like acyclovir are used instead. Alright, let's understand why certain treatments work for chickenpox itching. Varicella zoster virus causes chickenpox, creating those characteristic itchy vesicular lesions that appear in crops. The vesicles progress through stages, from fluid-filled blisters to crusted lesions. The intense itching can lead to scratching, which risks secondary bacterial infection and scarring. Calamine lotion works through a cooling and drying effect on the skin, providing relief from the itching sensation. Oatmeal baths similarly soothe irritated skin through anti-inflammatory properties. These topical treatments are safe and effective for symptom relief. The correct answer is calamine application, because it's a safe, non-pharmacological intervention that directly relieves itching through its cooling and drying properties without the risks associated with systemic medications. 6. A patient with Crohn's disease shows skip lesions and cobblestone appearance on colonoscopy. Which laboratory finding would most likely differentiate this from ulcerative colitis? A. Elevated CRP. B. Positive ASCA. C. Low hemoglobin. D. High ESR. Do you know the answer? Correct answer, B. Positive ASCA. Explanation: option B is correct because anti-Saccharomyces cerevisiae antibody positivity is more specific for Crohn's disease, while PANCA is associated with ulcerative colitis. Option A is incorrect because elevated C-reactive protein occurs in both Crohn's disease and ulcerative colitis during inflammatory episodes. Option C is incorrect because low hemoglobin from intestinal bleeding can occur in both inflammatory bowel disease conditions equally. Option D is incorrect because elevated erythrocyte sedimentation rate indicates inflammation but doesn't differentiate between IBD types specifically. This is a critical concept for differentiating inflammatory bowel diseases. Both Crohn's disease and ulcerative colitis cause intestinal inflammation, but they have distinct patterns and antibody markers. Crohn's disease can affect any part of the digestive tract and shows skip lesions, areas of inflammation separated by healthy tissue. It's associated with positive ASCA antibodies, which stands for anti-Saccharomyces cerevisiae antibodies. These antibodies react against components of Baker's yeast. In contrast, ulcerative colitis is limited to the colon and rectum with continuous inflammation, and it's associated with PANCA antibodies. The correct answer is positive ASCA because these antibodies are specifically associated with Crohn's disease, helping differentiate it from ulcerative colitis, where PANCA antibodies are more common. 7. An athlete presents with a resting heart rate of 38 beats per minute, but reports no symptoms. What condition best explains this finding during a sports physical examination? A. Cardiac arrhythmia. B. Hypothyroid state. C. Beta blocker use. D. Athletic heart syndrome. Can you guess the answer? Correct answer, D. Athletic heart syndrome. Explanation: option D is correct because athletic heart syndrome causes physiological bradycardia as the heart adapts to training stress, pumping more efficiently with fewer contractions. Option A is incorrect because cardiac arrhythmia would typically present with symptoms like dizziness, fatigue, or exercise intolerance clinically. Option B is incorrect because hyperthyroidism causes pathological bradycardia, accompanied by other metabolic symptoms like fatigue and cold intolerance. Option C is incorrect because beta blocker use would be documented in medical history and isn't a physiological adaptation phenomenon. To really understand athletic heart syndrome, let's explore this fascinating adaptation. When athletes engage in regular, intense cardiovascular training, their hearts undergo remarkable changes. The heart muscle becomes stronger and more efficient, developing increased chamber size and wall thickness. This adaptation allows the heart to pump more blood with each contraction, a higher stroke volume. Because each heartbeat moves more blood, the heart doesn't need to beat as frequently to meet the body's oxygen demands at rest. This results in bradycardia, often 40 beats per minute in elite athletes. This is completely physiological and beneficial, not pathological. The correct answer is athletic heart syndrome, because this condition represents a normal cardiovascular adaptation to training, where the enlarged, efficient heart requires fewer beats per minute. 8. A patient receiving chemotherapy develops oral thrush with white patches. Which pathogen is responsible for this opportunistic infection that commonly affects immunocompromised individuals? A. Candida albicans, B. Streptococcus mutans, C. Herpes simplex, D. Epstein-Barr virus. Do you know the answer? Correct answer A. Candida albicans. Explanation: option A is correct because Candida albicans is a fungus that causes oral thrush, appearing as milky white patches in immunocompromised patients receiving chemotherapy. Option B is incorrect because Streptococcus mutans primarily causes dental caries, not the characteristic white patches of oral thrush. Option C is incorrect because herpes simplex causes painful vesicular lesions on lips and mouth, not white plaque-like patches. Option D is incorrect because Epstein-Barr virus causes infectious mononucleosis with pharyngitis, not the fungal plaques of thrush. Let's examine the pathophysiology of oral thrush in immunocompromised patients. When chemotherapy suppresses the immune system, it creates an opportunity for normally controlled organisms to overgrow. Candida albicans is a fungus that naturally lives in small amounts in our mouths. In healthy individuals, the immune system and normal bacterial flora keep Candida in check. However, chemotherapy destroys rapidly dividing cells, including immune cells that normally prevent fungal overgrowth. Without this immune surveillance, Candida multiplies unchecked, forming the characteristic white, cottage cheese-like patches on the tongue, gums, and inner cheeks. These patches can be painful and may bleed when scraped. The correct answer is Candida albicans because this opportunistic fungus is the primary causative agent of oral thrush, especially in immunocompromised patients. 9. A diabetic patient on multiple medications develops severe hypoglycemia. Which concurrent medication class would most likely mask the warning signs of low blood sugar? A. ACE inhibitors, B. Thiazide diuretics, C. Beta blockers, D. Calcium antagonists. Can you guess the answer? Correct answer: C. Beta blockers. Explanation: option C is correct because beta blockers mask hypoglycemia symptoms by blocking adrenergic responses like tachycardia, tremor, and anxiety that warn of low glucose. Option A is incorrect because ACE inhibitors are actually preferred in diabetic patients and don't mask hypoglycemic warning symptoms typically. Option B is incorrect because thiazide diuretics may affect glucose levels, but don't block the sympathetic response to hypoglycemia symptoms. Option D is incorrect because calcium channel blockers don't interfere with the body's ability to recognize hypoglycemic warning signs effectively. Understanding drug interactions in diabetes is crucial for patient safety. Beta blockers are commonly prescribed for hypertension and heart conditions in diabetic patients. However, they create a dangerous situation regarding hypoglycemia recognition. When blood sugar drops, the body releases epinephrine and norepinephrine, triggering warning symptoms like rapid heartbeat, trembling, sweating, and anxiety. Beta blockers bind to beta receptors, blocking these catecholamines from producing their typical effects. This means the tachycardia, tremor, and anxiety that normally alert patients to low blood sugar are suppressed. Patients may not realize they're hypoglycemic until more severe symptoms like confusion or loss of consciousness occur. The correct answer is beta blockers because they mask the adrenergic warning signs of hypoglycemia by blocking the sympathetic nervous system response. 10. A patient with COPD experiences progressive dyspnea despite using short-acting bronchodilators. What medication class represents the next appropriate step in therapy escalation? A. Oral steroids. B. Antibiotics prophylaxis. C. Mucolytic agents. D. Long-acting bronchodilators. Do you know the answer? Correct answer, D. Long-acting bronchodilators. Explanation. Option D is correct because COPD guidelines recommend adding long-acting bronchodilators, like LABA or LAMA, when short-acting bronchodilators provide insufficient symptom control. Option A is incorrect because oral steroids are reserved for acute exacerbations, not routine maintenance therapy in stable COPD. Option B is incorrect because prophylactic antibiotics are considered only in specific cases with frequent exacerbations, not routine escalation. Option C is incorrect because mucolytic agents have limited evidence and aren't part of standard COPD treatment escalation algorithms. Now let's explore the stepwise approach to COPD management. COPD is a progressive disease requiring escalating therapy as symptoms worsen. Initially, patients use short-acting bronchodilators like albuterol for quick relief. When these become insufficient, the next logical step follows established guidelines. Long-acting bronchodilators, either LABAs or LAMAs, provide sustained bronchodilation for 12-24 hours, improving breathing throughout the day and night. These medications work by continuously relaxing airway smooth muscle, maintaining open airways. They reduce exacerbations, improve exercise tolerance, and enhance quality of life. Unlike oral steroids reserved for exacerbations, long-acting bronchodilators are for daily maintenance. The correct answer is long-acting bronchodilators because COPD guidelines recommend adding these for persistent symptoms when short-acting bronchodilators alone don't provide adequate control. 11. A child with G6PD deficiency must avoid certain triggers to prevent hemolytic crisis. Which food item poses the greatest risk for triggering red blood cell breakdown? A. Dairy products. B. Citrus fruits. C. Wheat bread. D. Fava beans. Can you guess the answer? Correct answer, D. Fava beans. Explanation. Option D is correct because fava beans and all legumes are major triggers for hemolytic anemia in G6PD deficiency, causing rapid red blood cell destruction. Option A is incorrect because dairy products are safe for G6PD deficient patients and don't trigger hemolytic crisis episodes. Option B is incorrect because while high-dose vitamin C supplements are avoided, normal citrus fruit consumption is generally safe. Option C is incorrect because wheat products don't contain compounds that trigger oxidative stress in G6PD deficient red blood cells. Let's dig into the principle behind G6PD deficiency and dietary triggers. G6PD deficiency is a genetic disorder affecting the enzyme glucose 6-phosphate dehydrogenase in red blood cells. This enzyme protects red cells from oxidative damage. Without sufficient G6PD, red blood cells become vulnerable to oxidative stress, leading to hemolysis, their premature destruction. Fava beans contain compounds called vesine and convesine that create massive oxidative stress. When someone with G6PD deficiency eats fava beans, These compounds overwhelm the already compromised antioxidant system, causing rapid red cell breakdown. This triggers hemolytic anemia with symptoms like dark urine, jaundice, and severe fatigue. The correct answer is fava beans because they contain the highest concentration of oxidative compounds that trigger hemolytic crisis in G6PD deficient individuals. 12. During thyroid storm, a patient presents with hypothermia and tachycardia. Which medication specifically blocks peripheral conversion of thyroid hormones to manage this crisis? A. Methimazole. B. Propylthiouracil. C. Levothyroxine. D. Potassium iodide. Do you know the answer? Correct answer, B. Propylthiouracil. Explanation, option B is correct because propylthiouracil both inhibits thyroid hormone synthesis and blocks peripheral conversion of T4 to T3 during thyrotoxic crisis, addressing both the production and activation of thyroid hormones. Option A is incorrect because methimazole only blocks thyroid hormone synthesis without affecting peripheral hormone conversion significantly in crisis, so it would not address the already circulating active hormones. Option C is incorrect because levothyroxine is thyroid replacement therapy that would worsen thyrotoxicosis, not treat the condition, as it would increase the levels of thyroid hormones. Option D is incorrect because potassium iodide blocks hormone release but doesn't affect peripheral conversion or synthesis mechanisms directly, making it less comprehensive for managing the acute crisis. This question explores the unique properties of medications used in thyroid storm. Thyroid storm is a life-threatening condition where excessive thyroid hormones cause severe symptoms. The body has two main thyroid hormones, T4 and the more active T3. Most T3 comes from peripheral conversion of T4. Propylthiouracil has a dual mechanism. It blocks new thyroid hormone synthesis in the gland and uniquely inhibits the peripheral conversion of T4 to T3. This peripheral blocking action is crucial in thyroid storm because it rapidly reduces the amount of active T3 in circulation. While methimazole only blocks synthesis, propylthiouracil provides this additional benefit during crisis management. The correct answer is propylthiouracil because it's the only antithyroid drug that both inhibits hormone synthesis and blocks peripheral T4 to T3 conversion. 13. A patient with myasthenia gravis experiences muscle weakness that improves with rest. Which therapeutic intervention directly addresses the underlying neuromuscular junction dysfunction? A. Corticosteroid therapy. B. Plasmapheresis treatment. C. Cholinesterase inhibitors. D. Immunoglobulin infusion. Can you guess the answer? Correct answer, C. Cholinesterase inhibitors. Explanation: option C is correct because cholinesterase inhibitors, like neostigmine, prevent acetylcholine breakdown, increasing levels at neuromuscular junctions to improve muscle contraction strength. Option A is incorrect because corticosteroids reduce inflammation, but don't directly improve neuromuscular transmission at the junction site itself. Option B is incorrect because plasmapheresis removes antibodies but doesn't directly enhance acetylcholine activity at neuromuscular junctions immediately. Option D is incorrect because immunoglobulin therapy modulates immune response but doesn't directly affect neurotransmitter levels at junctions. Let's explore the core treatment principle for myasthenia gravis. In this autoimmune disease, antibodies attack acetylcholine receptors at the neuromuscular junction, where nerves meet muscles. Normally, the nerve releases acetylcholine, which binds to muscle receptors, triggering contraction. In myasthenia gravis, with fewer functional receptors, the acetylcholine signal is too weak, causing muscle weakness. Cholinesterase inhibitors like neostigmine work by blocking the enzyme that breaks down acetylcholine. By preventing this breakdown, more acetylcholine accumulates in the junction, increasing the chance of receptor binding despite their reduced numbers. This directly improves muscle contraction strength, explaining why weakness improves after taking these medications. The correct answer is cholinesterase inhibitors because they directly address the neuromuscular transmission problem by increasing acetylcholine availability at the junction. 14. A pregnant woman in her third trimester asks about vaccine safety. Which immunization is specifically recommended between 27 and 36 weeks of pregnancy? A. MMR vaccine. B. Varicella vaccine. C. Influenza vaccine. D. Tdap vaccine. Do you know the answer? Correct answer, D. Tdap vaccine. Explanation: option D is correct because Tdap vaccination between 27 and 36 weeks provides maternal antibodies that protect newborns from pertussis during vulnerable early months. Option A is incorrect because MMR contains live attenuated viruses and is strictly contraindicated during pregnancy due to theoretical risks. Option B is incorrect because varicella vaccine contains live virus and must be avoided throughout pregnancy to prevent fetal complications. Option C is incorrect because while influenza vaccine is recommended, it's given any trimester, not specifically weeks 27-36 only. Understanding vaccine timing in pregnancy requires knowing about passive immunity transfer. The Tdap vaccine contains tetanus, diphtheria, and pertussis antigens. When given during pregnancy, the mother's immune system produces antibodies against these diseases. The timing of 27-36 weeks is crucial because this allows maximum antibody production before delivery. These maternal antibodies cross the placenta, providing the newborn with passive immunity. This is especially important for pertussis, or whooping cough, which can be fatal in infants too young for their own vaccinations. The antibodies protect the baby during the first few months of life until they can receive their own immunizations. The correct answer is Tdap vaccine because it's specifically recommended at 27-36 weeks to provide optimal maternal antibody transfer for newborn protection. 15. A patient with ulcerative colitis experiences bloody diarrhea with urgency. Which antibody test would most likely be positive in this condition versus Crohn's disease? A. Anti-CCP, B. PANCA, C. Anti-dsDNA, D. ASCA. Can you guess the answer? Correct answer, B. PANCA. Explanation: option B is correct because perinuclear anti-neutrophil cytoplasmic antibodies are more commonly positive in ulcerative colitis compared to Crohn's disease patients. Option A is incorrect because anti-CCP antibodies are specific for rheumatoid arthritis and are not used as inflammatory bowel disease differentiation markers. Option C is incorrect because anti-dsDNA antibodies are associated with systemic lupus erythematosus, not inflammatory bowel disease conditions. Option D is incorrect because ASCA antibodies are more specific for Crohn's disease rather than ulcerative colitis. To differentiate inflammatory bowel diseases, we need to understand their distinct antibody profiles. Ulcerative colitis and Crohn's disease both cause intestinal inflammation, but have different patterns and biomarkers. Ulcerative colitis specifically affects the colon and rectum with continuous mucosal inflammation. The immune system in UC patients often produces PANCA antibodies, perinuclear anti-neutrophil cytoplasmic antibodies. These antibodies target proteins in neutrophils and are found in about 70% of UC patients. In contrast, Crohn's disease patients more commonly have ASCA antibodies. This antibody distinction helps clinicians differentiate between the two conditions when diagnosis is unclear. The correct answer is panca because these antibodies are significantly more prevalent in ulcerative colitis compared to Crohn's disease. 16. An infant with sickle cell disease presents with painful hand swelling. What type of crisis is this child most likely experiencing? A. Aplastic crisis. B. Splenic sequestration. C. Vaso-occlusive crisis. D. Hemolytic crisis. Do you know the answer? Correct answer, C. Vaso-occlusive crisis. Explanation: option C is correct because vaso-occlusive crisis causes dactylitis, presenting as painful swelling of hands and feet when sickled cells block small vessels. Option A is incorrect because aplastic crisis presents with sudden pallor and weakness from dropping hemoglobin, not localized swelling. Option B is incorrect because splenic sequestration causes acute spleen enlargement with hypervolemic shock, not extremity swelling patterns. Option D is incorrect because hemolytic crisis involves increased red cell breakdown causing jaundice, not the focal pain swelling syndrome. Let's break down sickle cell crisis types to understand this presentation. In sickle cell disease, abnormal hemoglobin causes red blood cells to become rigid and crescent-shaped. These sickled cells can block small blood vessels, causing different types of crises. Vaso-occlusive crisis occurs when sickled cells obstruct blood flow to tissues. In infants, this commonly affects the small bones of hands and feet, causing dactylitis, painful swelling of digits. The blocked blood flow causes tissue ischemia, inflammation, and the characteristic swollen, painful extremities. This differs from aplastic crisis with sudden anemia or splenic sequestration with acute spleen enlargement. The correct answer is vaso-occlusive crisis because dactylitis, the painful hand and foot swelling in infants, is a classic presentation of vaso-occlusion in small vessels. 17. A patient with depression starts SSRI therapy. How long should the healthcare provider advise the patient to wait before expecting mood improvement? A. 24-48 hours. B. 3-5 days. C. 1 week. D. 2-4 weeks. Can you guess the answer? Correct answer, D. 2-4 weeks. Explanation: option D is correct because SSRIs typically require 2-4 weeks for mood improvement, though physical symptoms may improve earlier than emotional symptoms do. Option A is incorrect because 48 hours is too soon for SSRIs to produce noticeable mood changes in depressed patients. Option B is incorrect because 3-5 days may show initial side effects, but not therapeutic mood improvement benefits typically. Option C is incorrect because 1 week is generally insufficient time for SSRIs to achieve therapeutic mood elevation effects clinically. Let's examine the timeline of antidepressant effectiveness to set proper expectations. SSRIs, or selective serotonin reuptake inhibitors, work by blocking serotonin reuptake at synapses, increasing serotonin availability. However, this immediate biochemical change doesn't translate to immediate mood improvement. The brain needs time to adapt to increased serotonin levels through receptor changes and neural pathway adjustments. During the first week, patients may experience side effects like nausea or headache. Physical symptoms like sleep and appetite may improve first. True mood elevation typically requires 2-4 weeks as the brain undergoes neuroplastic changes. Some patients may need 6-8 weeks for full therapeutic effect. The correct answer is 2-4 weeks because this is the typical time frame for SSRIs to produce noticeable mood improvement in depression. 18. A patient with chronic kidney disease stage 3 has hypertension. Which antihypertensive class provides renal protective benefits beyond blood pressure control? A. ACE inhibitors. B. Beta blockers. C. Loop diuretics. D. Calcium blockers. Do you know the answer? Correct answer, A. ACE inhibitors. Explanation: option A is correct because ACE inhibitors provide renoprotective effects by reducing intraglomerular pressure and proteinuria beyond simple blood pressure reduction benefits. Option B is incorrect because beta blockers lower blood pressure but don't provide specific renal protective benefits in chronic kidney disease. Option C is incorrect because loop diuretics manage fluid overload but don't slow chronic kidney disease progression or provide renoprotection. Option D is incorrect because calcium channel blockers control hypertension but lack the specific renoprotective properties of ACE inhibitors. Understanding renoprotection in chronic kidney disease is vital for slowing progression. CKD stage 3 indicates moderate kidney function loss with ongoing damage risk. While controlling blood pressure is important, certain medications provide additional kidney protection. ACE inhibitors work by blocking angiotensin II formation, which reduces pressure within the kidney's filtering units, the glomeruli. This decreased intraglomerular pressure protects delicate kidney structures from further damage. ACE inhibitors also reduce proteinuria, protein loss in urine that accelerates kidney damage. Studies show ACE inhibitors slow CKD progression, independent of blood pressure effects. They're particularly beneficial in diabetic kidney disease. The correct answer is ACE inhibitors because they provide specific renoprotective benefits through reducing intraglomerular pressure and proteinuria beyond simple blood pressure control. 19. During pneumonia assessment, a nurse notes dullness to percussion and increased tactile fremitus. What type of pneumonia do these findings suggest? A. Viral pneumonia. B. Atypical pneumonia. C. Bacterial pneumonia. D. Fungal pneumonia. Can you guess the answer? Correct answer, C. Bacterial pneumonia. Explanation: option C is correct because bacterial pneumonia causes consolidation with dullness to percussion and increased tactile fremitus from dense inflammatory infiltrate presence. Option A is incorrect because viral pneumonia typically shows diffuse infiltrates without the focal consolidation causing these physical findings. Option B is incorrect because atypical pneumonia usually presents with minimal physical findings despite significant radiographic changes present clinically. Option D is incorrect because fungal pneumonia is less common and doesn't typically present with classic consolidation findings initially. Physical examination findings in pneumonia tell us about the underlying pathology. When bacteria invade the alveoli, they trigger an inflammatory response with white blood cells and fluid accumulation. This inflammatory exudate fills the air spaces, creating consolidation, solid tissue where air should be. During percussion, this consolidated lung produces a dull sound instead of normal resonance, like tapping on solid wood versus a hollow drum. Tactile fremitus, vibrations felt when the patient speaks, increases because solid tissue conducts vibrations better than air-filled lung. These findings contrast with viral pneumonia's diffuse pattern without focal consolidation. The correct answer is bacterial pneumonia because the combination of dullness to percussion and increased tactile fremitus indicates lung consolidation typical of bacterial infection. 20. A patient taking warfarin is prescribed doxycycline for infection. What laboratory value requires close monitoring due to drug interaction risk? A. Platelet count. B. INR level. C. Hemoglobin value. D. WBC count. Do you know the answer? Correct answer, B. INR level. Explanation: option B is correct because doxycycline enhances warfarin's anticoagulant effect, requiring INR monitoring to prevent bleeding complications from excessive anticoagulation occurring. Option A is incorrect because platelet count isn't affected by the warfarin-doxycycline interaction, though important for bleeding risk assessment. Option C is incorrect because hemoglobin monitoring detects bleeding but doesn't predict the interaction's effect on anticoagulation intensity directly. Option D is incorrect because white blood cell count monitors infection response but isn't affected by this drug interaction. Drug interactions with warfarin require careful monitoring to prevent bleeding complications. Warfarin works by inhibiting vitamin K-dependent clotting factors, and its effect is measured by INR, International Normalized Ratio. Normal INR is around 1.0, while therapeutic anticoagulation usually targets 2, 3. Doxycycline, a tetracycline antibiotic, enhances warfarin's anticoagulant effect through several mechanisms. It may displace warfarin from protein binding sites and affect gut bacteria that produce vitamin K. This interaction can push the INR dangerously high, increasing bleeding risk. Regular INR monitoring becomes essential when these drugs are used together. The correct answer is INR level, because doxycycline potentiates warfarin's effect, requiring close monitoring of anticoagulation intensity to prevent bleeding. 21. A child with Hutchinson-Gilford progeria syndrome shows accelerated aging. Which genetic test confirms this diagnosis by detecting the causative mutation? A. BRCA analysis. B. LMNA testing. C. Karyotype study. D. HLA typing. Can you guess the answer? Correct answer, B. LMNA testing. Explanation: option B is correct because LMNA gene mutation testing confirms progeria diagnosis by detecting the mutation causing abnormal lamin A protein production. Option A is incorrect because BRCA analysis tests for breast cancer susceptibility genes, not the progeria-causing genetic mutation present. Option C is incorrect because karyotype studies show chromosomal structure but don't detect the specific LMNA point mutation involved. Option D is incorrect because HLA typing determines tissue compatibility for transplants, not genetic mutations causing accelerated aging. Let's explore the genetic basis of Hutchinson-Gilford progeria syndrome and its diagnosis. Progeria is an extremely rare genetic disorder causing children to age at an accelerated rate. The condition results from a mutation in the LMNA gene, which provides instructions for making lamin A protein. This protein is crucial for maintaining the structural integrity of the cell nucleus. When mutated, it produces an abnormal protein called progerin that makes the nucleus unstable. This instability causes cells to die prematurely, leading to the rapid aging symptoms, growth delays, hair loss, and cardiovascular problems. Children typically appear normal at birth but develop symptoms within the first 2 years. The correct answer is LMNA testing, because detecting this specific gene mutation confirms the progeria diagnosis definitively. 22. A patient with postural orthostatic tachycardia syndrome experiences heart rate increase upon standing. What heart rate change threshold confirms POTS diagnosis? A. Greater than 15 BPM. B. Greater than 20 BPM. C. Greater than 25 BPM. D. Greater than 30 BPM. Do you know the answer? Correct answer, D. Greater than 30 BPM. Explanation: option D is correct because POTS diagnosis requires a heart rate increase greater than 30 BPM within 10 minutes of standing without orthostatic hypertension. Option A is incorrect because a 15 BPM increase is within the normal physiological response to position change, not a diagnostic criterion for POTS. Option B is incorrect because a 20 BPM increase may occur normally and does not meet the diagnostic threshold for POTS. Option C is incorrect because a 25 BPM increase approaches but does not meet the 30 BPM diagnostic criterion for adults. Understanding POTS diagnosis requires knowing the specific cardiovascular criteria. Postural orthostatic tachycardia syndrome is a form of dysautonomia affecting how the body regulates heart rate and blood pressure upon standing. When a healthy person stands, blood pools in the legs, triggering compensatory mechanisms to maintain circulation. In POTS, this compensation is exaggerated. The diagnostic criterion is a heart rate increase of more than 30 beats per minute within 10 minutes of standing, without orthostatic hypertension. For example, if sitting heart rate is 70, it must exceed 100 when standing. This excessive tachycardia occurs because the autonomic nervous system overcompensates for the blood pooling. The correct answer is greater than 30 BPM, because this specific threshold distinguishes POTS from normal physiological responses to position change. 23. A patient with generalized anxiety disorder needs medication. Which benzodiazepine is considered first-line treatment for this condition? A. Alprazolam, B. Clonazepam, C. Diazepam, D. Lorazepam. Can you guess the answer? Correct answer B. Clonazepam. Explanation: option B is correct because clonazepam is the first-line benzodiazepine for generalized anxiety disorder due to its longer half-life and steady effects. Option A is incorrect because alprazolam has a shorter half-life, leading to more frequent dosing and potential rebound anxiety. Option C is incorrect because diazepam is typically reserved for acute anxiety or muscle spasm rather than generalized anxiety disorder maintenance. Option D is incorrect because lorazepam is preferred for acute anxiety episodes rather than long-term generalized anxiety disorder management typically. To understand first-line benzodiazepine choice for generalized anxiety disorder, let's examine medication properties. GAD requires sustained anxiolytic coverage throughout the day to manage persistent worry. Benzodiazepines differ in their half-lives and duration of action. Clonazepam has a long half-life of 30–40 hours, providing steady, sustained anxiety relief with less frequent dosing. This longer action reduces the risk of rebound anxiety between doses and provides more consistent symptom control. Its smooth pharmacokinetic profile makes it ideal for chronic anxiety management. In contrast, shorter-acting benzodiazepines like alprazolam require multiple daily doses and can cause interdose anxiety. The correct answer is clonazepam because its longer half-life and steady effects make it the preferred first-line benzodiazepine for GAD. 24. A patient with medullary thyroid cancer has elevated calcitonin levels. Which genetic counselling recommendation is most important for family members? A. RET testing, B. BRCA screening, C. Lynch evaluation, D. VHL analysis. Do you know the answer? Correct answer, A. RET testing. Explanation: option A is correct because RET proto-oncogene testing identifies family members at risk for hereditary medullary thyroid cancer, requiring prophylactic thyroidectomy consideration. Option B is incorrect because BRCA screening identifies breast and ovarian cancer risk, not thyroid cancer susceptibility genes involved in medullary thyroid cancer. Option C is incorrect because Lynch syndrome evaluation screens for colorectal cancer risk, not medullary thyroid cancer predisposition markers. Option D is incorrect because VHL analysis detects von Hippel-Lindau disease, which is not related to the RET mutations causing medullary thyroid cancer. Genetic counselling in medullary thyroid cancer focuses on identifying at-risk family members. MTC differs from other thyroid cancers because it often has a hereditary component. The RET proto-oncogene, located on chromosome 10 when mutated, causes hereditary MTC. Family members who inherit this mutation have nearly 100% lifetime risk of developing MTC. RET testing allows identification of mutation carriers before cancer develops. This is crucial because prophylactic thyroidectomy in childhood can prevent cancer entirely. The timing of surgery depends on the specific RET mutation type. Without testing and preventive surgery, carriers will inevitably develop cancer. The correct answer is RET testing because identifying this mutation in family members enables life-saving prophylactic thyroidectomy before cancer develops. 25. A patient with tuberculosis starts 4-drug therapy. Which medication specifically requires avoiding oral contraceptives due to decreased effectiveness? A. Isoniazid. B. Ethambutol. C. Rifampin. D. Pyrazinamide. Can you guess the answer? Correct answer, C. Rifampin. Explanation: option C is correct because rifampin induces liver enzymes that accelerate oral contraceptive metabolism, reducing their effectiveness and requiring alternative contraception methods. Option A is incorrect because isoniazid doesn't significantly affect oral contraceptive metabolism or effectiveness when used for tuberculosis. Option B is incorrect because ethambutol doesn't interact with hormonal contraceptives or affect their therapeutic efficacy in patients. Option D is incorrect because pyrazinamide doesn't induce hepatic enzymes that would reduce oral contraceptive effectiveness during treatment. Drug interactions in tuberculosis treatment require careful consideration of contraceptive effectiveness. TB treatment involves 4 drugs: isoniazid, rifampin, ethambutol, and pyrazinamide. Rifampin is a potent inducer of cytochrome P450 enzymes in the liver. These enzymes metabolize many medications, including oral contraceptives containing estrogen and progesterone. When rifampin induces these enzymes, it accelerates the breakdown of contraceptive hormones, reducing their blood levels below therapeutic effectiveness. This can lead to contraceptive failure and unintended pregnancy. Women taking rifampin need alternative contraception, like barrier methods or IUDs. Other TB drugs don't have this significant interaction. The correct answer is rifampin, because it induces liver enzymes that metabolize oral contraceptives, requiring alternative contraception methods during treatment. 26. An elderly patient with Alzheimer's disease is in the moderate stage. Which medication combination is most appropriate for severe symptom management? A. Donepezil alone. B. Memantine alone. C. Rivastigmine alone. D. Donepezil-memantine combination. Do you know the answer? Correct answer, D. Donepezil-memantine combination. Explanation: option D is correct because combination therapy with donepezil and memantine is indicated for severe Alzheimer's, targeting different neurotransmitter systems for optimal effect. Option A is incorrect because donepezil monotherapy is typically insufficient for the symptom management needs present in severe Alzheimer's disease. Option B is incorrect because memantine alone does not provide the cholinergic enhancement needed for comprehensive severe Alzheimer's treatment. Option C is incorrect because rivastigmine monotherapy, while effective, does not provide the dual mechanism benefits of combination therapy. Managing severe Alzheimer's disease requires understanding combination therapy rationale. As Alzheimer's progresses to severe stages, single medications become insufficient. The brain experiences massive neurotransmitter dysfunction, involving both cholinergic and glutamatergic systems. Donepezil, a cholinesterase inhibitor, preserves acetylcholine by preventing its breakdown, supporting memory and cognition. Memantine works differently. It's an NMDA receptor antagonist that regulates glutamate, preventing excitotoxicity while maintaining normal signaling. Using both medications together targets two different neurotransmitter systems simultaneously. Studies show this combination provides better symptom control than either drug alone in severe disease. The synergistic effect helps maintain function longer. The correct answer is don-pezil-memantine combination because severe Alzheimer's requires dual mechanism therapy targeting both cholinergic and glutamatergic dysfunction. 27. A patient with parathyroid dysfunction presents with kidney stones and osteoporosis. Which medication class helps bones retain calcium in hyperparathyroidism? A. Bisphosphonates, B. Loop diuretics, C. Beta blockers, D. ACE inhibitors. Can you guess the answer? Correct answer, A. Bisphosphonates. Explanation: option A is correct because bisphosphonates prevent calcium loss from bones, reducing osteoporosis risk in hyperparathyroidism while managing hypercalcemia effectively. Option B is incorrect because loop diuretics actually increase calcium excretion, potentially worsening bone loss in these patients. Option C is incorrect because beta blockers don't affect calcium metabolism or bone density in parathyroid dysfunction management protocols. Option D is incorrect because ACE inhibitors don't influence calcium homeostasis or bone metabolism in hyperparathyroid conditions treated. Let's examine how bisphosphonates help manage hyperparathyroidism complications. In hyperparathyroidism, excess parathyroid hormone causes bones to release calcium into the bloodstream. This leads to two major problems: osteoporosis from bone calcium loss and hypercalcemia causing kidney stones. Bisphosphonates work by binding to bone mineral surfaces, particularly at sites of active resorption. They're absorbed by osteoclasts, the cells that break down bone. Once inside osteoclasts, bisphosphonates disrupt their function and induce apoptosis. This dramatically reduces bone breakdown, keeping calcium in bones where it belongs. By preventing calcium release, bisphosphonates help maintain bone density and reduce blood calcium levels. The correct answer is bisphosphonates because they specifically prevent bone calcium loss, addressing both osteoporosis and hypercalcemia in hyperparathyroidism. 28. A child with otitis media doesn't improve after 72 hours of observation. What antibiotic represents first-line treatment for uncomplicated cases? A. Azithromycin, B. Cephalexin, C. Amoxicillin, D. Trimethoprim. Do you know the answer? Correct answer, C. Amoxicillin. Explanation: option C is correct because amoxicillin is the first-line antibiotic for pediatric otitis media when bacterial infection is suspected after an observation period. Option A is incorrect because azithromycin is typically reserved for patients with a penicillin allergy and is not the first-line treatment in uncomplicated cases. Option B is incorrect because cephalexin is an alternative option, but not the preferred first-line agent for otitis media. Option D is incorrect because trimethoprim sulfamethoxazole is generally considered a second-line therapy when first-line antibiotics fail or allergies are present. Pediatric otitis media treatment follows evidence-based guidelines for antibiotic selection. After 72 hours of watchful waiting, persistent symptoms suggest bacterial infection requiring antibiotics. The most common bacteria causing otitis media is Streptococcus pneumoniae, followed by Haemophilus influenzae. Amoxicillin remains the first-line choice due to its excellent middle ear penetration, safety profile, and effectiveness against common pathogens. High-dose amoxicillin overcomes most pneumococcal resistance. Its narrow spectrum minimizes disruption to normal flora. The medication is well tolerated with palatable liquid formulations for children. Alternative antibiotics are reserved for amoxicillin failures or allergies. The correct answer is amoxicillin because it's the evidence-based first-line antibiotic for uncomplicated pediatric otitis media, effective against the most common causative bacteria. 29. A patient with pleural effusion secondary to heart failure needs treatment. Which medication class most directly addresses the underlying fluid accumulation? A. Antibiotics. B. Diuretics. C. Bronchodilators. D. Anticoagulants. Can you guess the answer? Correct answer, B. Diuretics. Explanation: option B is correct because diuretics remove excess fluid, causing pleural effusion in heart failure by promoting renal excretion and reducing volume overload. Option A is incorrect because antibiotics treat infectious causes of pleural effusion, not the heart failure-related fluid accumulation present. Option C is incorrect because bronchodilators address airway obstruction, but don't remove the pleural fluid, causing respiratory compromise. Option D is incorrect because anticoagulants prevent thrombosis, but don't address the fluid accumulation mechanism in heart failure. Understanding pleural effusion treatment requires matching therapy to underlying etiology. In heart failure, the weakened heart cannot pump effectively, causing fluid backup. This increased hydrostatic pressure forces fluid into the pleural space between lung and chest wall. The key to treatment is removing excess fluid from the body. Diuretics, particularly loop diuretics like furosemide, work at the kidney's loop of Henle to promote sodium and water excretion. By reducing total body fluid volume, diuretics decrease the hydrostatic pressure, forcing fluid into the pleural space. This allows existing pleural fluid to be reabsorbed. The effect addresses the root cause rather than just draining the effusion. The correct answer is diuretics, because they treat heart failure-related pleural effusion by reducing volume overload, the underlying mechanism. 30. A patient with schizophrenia on first-generation antipsychotics develops tardive dyskinesia. What characteristic movement pattern defines this condition? A. Resting tremor. B. Muscle rigidity. C. Irregular jerking. D. Sustained contractions. Do you know the answer? Correct answer, C. Irregular jerking. Explanation: option C is correct because tardive dyskinesia presents as irregular, involuntary, jerky movements of the lower face and distal extremities from antipsychotic use. Option A is incorrect because resting tremor is characteristic of Parkinsonism, another extrapyramidal side effect but distinct from tardive dyskinesia. Option B is incorrect because muscle rigidity occurs in neuroleptic, malignant syndrome or Parkinsonism, not tardive dyskinesia movements typically. Option D is incorrect because sustained muscle contractions describe dystonia, a different extrapyramidal reaction to antipsychotic medications given. Tardive dyskinesia represents a serious complication of antipsychotic therapy requiring recognition. First-generation antipsychotics block dopamine receptors in the brain's motor pathways. With chronic blockade, these receptors become hypersensitive, a process called upregulation. When dopamine eventually binds to these hypersensitive receptors, it triggers excessive motor activity. Tardive dyskinesia manifests as involuntary, irregular, jerky movements, particularly affecting the lower face, lip smacking, tongue protrusion, and grimacing. The distal extremities show chaw-reform movements. These differ from other extrapyramidal effects, like tremor or rigidity. The movements worsen with stress and disappear during sleep. The condition may be irreversible even after stopping the medication. The correct answer is irregular jerking because tardive dyskinesia specifically causes involuntary, irregular jerky movements of the face and extremities. 31. A patient with hypertension and benign prostatic hyperplasia needs treatment. Which medication addresses both conditions through alpha receptor antagonism? A. Tamsulosin. B. Finasteride. C. Metoprolol. D. Lisinopril. Can you guess the answer? Correct answer, A. Tamsulosin. Explanation: option A is correct because tamsulosin is an alpha-1 antagonist that relaxes prostate's smooth muscle for BPH while causing vasodilation for hypertension. Option B is incorrect because finasteride reduces prostate size through hormonal effects but does not treat hypertension or cause vasodilation. Option C is incorrect because metoprolol is a beta blocker treating hypertension but does not improve urinary symptoms from BPH. Option D is incorrect because lisinopril treats hypertension through ACE inhibition but does not affect prostate's smooth muscle tone. Selecting medications that address multiple conditions simultaneously improves patient care. For combined hypertension and benign prostatic hyperplasia, alpha-1 antagonists offer dual benefits. The prostate gland contains abundant alpha-1 receptors in its smooth muscle. BPH causes prostate enlargement, compressing the urethra and causing urinary symptoms. Tamsulosin blocks these alpha-1 receptors, relaxing prostatic smooth muscle and improving urine flow. Additionally, alpha-1 receptors in blood vessels control vasoconstriction. Blocking these receptors causes vasodilation, lowering blood pressure. While tamsulosin is more selective for prostate receptors, it still provides some blood pressure reduction. This dual action makes it ideal for patients with both conditions. The correct answer is tamsulosin, because it's an alpha-1 antagonist treating both BPH through prostate muscle relaxation and hypertension through vasodilation. 32. A patient with chronic obstructive pulmonary disease has frequent exacerbations despite bronchodilator therapy. Which add-on medication reduces exacerbation frequency? A. Theophylline. B. Roflumilast. C. Montelukast. D. Cromolyn. Do you know the answer? Correct answer, B. Roflumilast. Explanation: option B is correct because roflumilast is a PDE4 inhibitor specifically indicated for COPD with chronic bronchitis to reduce exacerbation frequency significantly. Option A is incorrect because theophylline has modest benefits with a narrow therapeutic window and is not primarily for exacerbation prevention. Option C is incorrect because montelukast is used in asthma management but has limited evidence for COPD exacerbation prevention. Option D is incorrect because cromolyn is a mast cell stabilizer for asthma prophylaxis, not COPD exacerbation reduction therapy. COPD exacerbation prevention requires understanding specific medication mechanisms. Despite optimal bronchodilator therapy, some COPD patients experience frequent exacerbations. These episodes involve increased inflammation, mucus production, and airway obstruction. Roflumilast is a phosphodiesterase 4 inhibitor specifically developed for COPD with chronic bronchitis. PDE4 enzymes break down cyclic AMP, a molecule that reduces inflammation. By inhibiting PDE4, roflumilast increases cyclic AMP levels, suppressing inflammatory cell activity and reducing inflammatory mediator release. This targeted anti-inflammatory effect specifically benefits patients with the chronic bronchitis phenotype who produce excessive mucus. Studies show roflumilast reduces exacerbation frequency by about 15 to 20%. The correct answer is roflumilast because it's the only PDE4 inhibitor specifically indicated for reducing exacerbations in COPD with chronic bronchitis. 33. A patient taking St. John's wort for depression starts digoxin for atrial fibrillation. What interaction mechanism poses the greatest risk? A. Renal competition. B. Protein displacement. C. Absorption interference. D. CYP3A4 induction. Can you guess the answer? Correct answer, D, CYP3A4 induction. Explanation. Option D is correct because St. John's wort induces CYP3A4 enzymes, accelerating digoxin metabolism and reducing therapeutic levels, risking treatment failure occurring. Option A is incorrect because these drugs don't compete for renal excretion pathways that would affect drug elimination rates. Option B is incorrect because protein binding displacement isn't the primary interaction mechanism between these two medications used together. Option C is incorrect because St. John's wort doesn't significantly interfere with digoxin's gastrointestinal absorption when taken concurrently. Drug-herb interactions can significantly impact medication effectiveness and patient safety. St. John's wort, used for depression, is notorious for drug interactions. It potently induces CYP3A4, a major drug metabolizing enzyme in the liver. Digoxin, used for atrial fibrillation, has a narrow therapeutic window. Small changes in levels can cause toxicity or treatment failure. When St. John's wort induces CYP3A4, it accelerates digoxin metabolism, reducing blood levels below therapeutic range. This can lead to loss of rate control in atrial fibrillation, potentially causing rapid ventricular response and heart failure. The interaction can reduce digoxin levels by up to 25%. Patients may experience symptom recurrence despite taking their medication correctly. The correct answer is CYP3A4 induction, because St. John's wort induces this enzyme, accelerating digoxin metabolism and causing subtherapeutic levels. 34. A patient with asthma poorly controlled on low-dose inhaled corticosteroids needs step-up therapy. For a growing teenager, which alternative avoids growth concerns? A. Medium-dose ICS. B. Oral prednisone. C. Leukotriene antagonist. D. Antibiotic prophylaxis. Do you know the answer? Correct answer, C. Leukotriene antagonist. Explanation: option C is correct because leukotriene receptor antagonists like montelukast avoid potential growth effects of medium-dose inhaled corticosteroids in teenage patients. Option A is incorrect because medium-dose ICS may affect growth velocity in teenagers, making it less desirable for this population. Option B is incorrect because oral prednisone has systemic effects, including growth suppression, worse than inhaled corticosteroid concerns. Option D is incorrect because antibiotic prophylaxis isn't indicated for asthma control and doesn't address underlying airway inflammation present. Asthma management in growing teenagers requires balancing efficacy with growth concerns. When low-dose inhaled corticosteroids prove insufficient, guidelines suggest step-up therapy. However, medium-dose ICS may affect growth velocity during crucial developmental years. Leukotriene receptor antagonists like montelukast offer an alternative approach. They block leukotrienes, inflammatory mediators that cause bronchoconstriction, mucus production, and airway inflammation. Montelukast provides anti-inflammatory effects through a completely different mechanism than steroids. It doesn't affect the hypothalamic, pituitary, adrenal axis, or bone metabolism. Studies show it's effective for mild, persistent asthma without growth suppression. This makes it particularly valuable for teenagers concerned about reaching full height potential. The correct answer is leukotriene antagonist, because it provides asthma control without the potential growth effects of medium-dose inhaled corticosteroids. 35. A diabetic patient develops ketoacidosis with blood glucose over 300 mg/dL. Which clinical finding most specifically indicates this complication? A. Excessive thirst. B. Frequent urination. C. Fruity breath. D. Skin flushing. Can you guess the answer? Correct answer, C. fruity breath. Explanation: option C is correct because fruity breath odour from acetone is pathognomonic for diabetic ketoacidosis, indicating ketone body production from fat metabolism. Option A is incorrect because excessive thirst occurs in both hyperglycemia and DKA, not specifically to ketoacidosis development alone. Option B is incorrect because frequent urination happens with any significant hyperglycemia, not uniquely indicating ketoacidosis presence clinically. Option D is incorrect because skin flushing can occur with various conditions and isn't specific to diabetic ketoacidosis diagnosis. Diabetic ketoacidosis presents with specific metabolic derangements, creating characteristic signs. When insulin is severely deficient, cells cannot use glucose for energy. The body shifts to fat metabolism, breaking down fatty acids for fuel. This process produces ketone bodies: acetoacetate, beta-hydroxybutyrate, and acetone. While the first two are acids causing dangerous acidosis, acetone is volatile and exhaled through the lungs. This creates the pathognomonic fruity or sweet breath odour, like nail polish remover or overripe fruit. This sign specifically indicates ketone production, distinguishing DKA from simple hyperglycemia. Other symptoms like thirst and urination occur with any high blood sugar, but fruity breath uniquely indicates ketoacidosis. The correct answer is fruity breath, because this acetone odour is the specific pathognomonic sign of ketone body production in DKA. 36. A patient with inflammatory bowel disease shows continuous inflammation from rectum through colon without skip areas. Which diagnosis is most likely? A. Crohn's disease. B. Celiac disease. C. Diverticulitis. D. Ulcerative colitis. Do you know the answer? Correct answer: D. Ulcerative colitis. Explanation: option D is correct because ulcerative colitis causes continuous inflammation limited to colon and rectum mucosa, unlike Crohn's skip lesion pattern throughout the GI tract. Option A is incorrect because Crohn's disease characteristically shows skip lesions with normal tissue between inflamed areas throughout the intestines. Option B is incorrect because celiac disease affects the small intestine in rare response to gluten, not the continuous colonic inflammation described. Option C is incorrect because diverticulitis causes localized inflammation at diverticular sites, not continuous mucosal involvement patterns seen. Differentiating inflammatory bowel diseases requires understanding their distinct anatomical patterns. Ulcerative colitis has a very specific distribution. It always starts in the rectum and extends proximally in a continuous fashion. The inflammation is limited to the mucosa and submucosa of the colon, never affecting the small intestine. There are no skip areas. The inflammation forms an uninterrupted sheet from rectum upward. This continuous pattern contrasts sharply with Crohn's disease, which shows patchy skip lesions throughout any part of the GI tract. The continuous rectal involvement explains why UC patients experience urgency and frequent bloody stools. Colonoscopy reveals uniform inflammation without normal areas between affected regions. The correct answer is ulcerative colitis because continuous colonic inflammation, starting from the rectum without skip areas, is its defining characteristic. 37. A patient with migraine headaches unresponsive to standard treatments receives botulinum toxin injections. What mechanism explains this therapeutic approach? A. Vascular dilation. B. Serotonin modulation. C. Muscle paralysis. D. Pain transmission. Can you guess the answer? Correct answer: C. Muscle paralysis. Explanation: option C is correct because botulinum toxin treats chronic migraines by paralyzing specific head and neck muscles, reducing tension-triggered headache patterns effectively. Option A is incorrect because botulinum toxin doesn't directly affect vascular tone that contributes to migraine pathophysiology mechanisms involved. Option B is incorrect because Botox doesn't modulate serotonin pathways like triptans or other migraine-specific medications do therapeutically. Option D is incorrect because while Botox may affect pain signaling indirectly, its primary mechanism is neuromuscular blockade achieved. Botulinum toxin for chronic migraine works through a unique neuromuscular mechanism. Chronic migraines often involve muscle tension in the head, neck and shoulders that triggers or perpetuates headaches. Botulinum toxin blocks acetylcholine release at neuromuscular junctions, preventing muscle contraction. When injected into specific muscles around the head and neck, frontalis, temporalis, occipitalis, cervical paraspinal, it causes targeted muscle paralysis. This breaks the cycle of muscle tension triggering migraines. The paralysis lasts 3-4 months, providing sustained prevention. Additionally, Botox may affect pain signaling pathways beyond simple muscle relaxation. Studies show it reduces migraine frequency by about 50% in chronic sufferers. The correct answer is muscle paralysis because botulinum toxin's primary mechanism involves paralyzing head and neck muscles that contribute to migraine triggers. 38. During pregnancy, a patient develops urinary tract infection. Which antibiotic provides safe single-dose treatment without teratogenic risks? A. Phosphomycin, B. Nitrofurantoin, C. Ciprofloxacin, D. Trimethoprim. Do you know the answer? Correct answer, A. Phosphomycin. Explanation: Option A is correct because phosphomycin as a single dose is safe during pregnancy for UTI treatment without the risks associated with other antibiotics. Option B is incorrect because nitrofurantoin has potential risks, especially in the first trimester and near term, requiring careful consideration. Option C is incorrect because fluoroquinolones like ciprofloxacin are contraindicated in pregnancy due to potential cartilage damage risks present. Option D is incorrect because trimethoprim interferes with folate metabolism, posing neural tube defect risks during early pregnancy particularly. Antibiotic selection during pregnancy requires balancing maternal treatment needs with fetal safety. Urinary tract infections in pregnancy need prompt treatment to prevent complications. Phosphomycin offers unique advantages as a single-dose treatment. It's a phosphonic acid derivative that disrupts bacterial cell wall synthesis differently than beta-lactams. Phosphomycin crosses the placenta minimally and has shown no teratogenic effects in studies. The single-dose regimen ensures complete treatment compliance, crucial during pregnancy. It achieves high urinary concentrations, effectively treating common UTI pathogens like E. coli. Unlike fluoroquinolones causing cartilage damage or trimethoprim affecting folate metabolism, phosphomycin has no known fetal risks. Its safety profile makes it ideal for pregnancy. The correct answer is phosphomycin because it provides safe, effective single-dose UTI treatment without teratogenic risks during pregnancy. 39. A patient with PTSD experiences recurrent nightmares despite SSRI therapy. Which medication specifically targets trauma-related nightmares? A. Clonidine, B. Prazosin, C. Propranolol, D. Gabapentin. Can you guess the answer? Correct answer, B. Prazosin. Explanation: Option B is correct because prazosin, an alpha-1 antagonist, specifically reduces PTSD-associated nightmares by blocking noradrenergic hyperactivity during REM sleep phases. Option A is incorrect because clonidine treats hypertension and ADHD symptoms, but doesn't specifically target PTSD nightmare reduction effectively. Option C is incorrect because propranolol may help performance anxiety, but isn't indicated for PTSD-related nightmare management specifically. Option D is incorrect because gabapentin treats neuropathic pain and seizures, but lacks evidence for PTSD nightmare reduction particularly. PTSD nightmare treatment requires understanding specific noradrenergic mechanisms. PTSD involves hyperactivation of the sympathetic nervous system, particularly during REM sleep when nightmares occur. This brain releases excessive norepinephrine, creating vivid, disturbing dreams that re-traumatize patients. Prazosin is an alpha-1 adrenergic antagonist originally developed for hypertension. It blocks norepinephrine's effects at alpha-1 receptors in the brain. By dampening this excessive noradrenergic activity during sleep, prazosin reduces nightmare intensity and frequency without affecting normal sleep architecture. Unlike sedatives that suppress all dreaming, prazosin specifically targets the hyperarousal component. Studies show significant reduction in trauma-related nightmares. Patients report better sleep quality and reduced daytime PTSD symptoms. The correct answer is prazosin, because it specifically blocks noradrenergic hyperactivity during REM sleep, reducing PTSD-associated nightmares. 40. A patient with ataxia shows wide-based gait and slurred speech resembling intoxication. Which anatomical structure damage causes these symptoms? A. Cerebellum, B. Hippocampus, C. Thalamus, D. Amygdala. Do you know the answer? Correct answer, A. Cerebellum. Explanation: option A is correct because cerebellar damage causes ataxia with coordination problems, wide-based gait, and slurred speech by disrupting motor control centers. Option B is incorrect because hippocampal damage affects memory formation primarily, not the motor coordination symptoms described here clinically. Option C is incorrect because thalamic lesions cause sensory deficits or consciousness changes rather than coordination problems typically observed. Option D is incorrect because amygdala damage affects emotional processing and fear responses, not motor control or coordination abilities. Ataxia's characteristic symptoms directly relate to cerebellar anatomy and function. The cerebellum, located at the brain's base, coordinates voluntary movements, balance, and posture. It doesn't initiate movement but refines it, ensuring smooth, accurate motion. When the cerebellum is damaged, this coordination fails. Movements become jerky and imprecise. The wide-based gait develops as patients try to maintain balance without proper cerebellar input. Speech becomes slurred because the cerebellum coordinates the precise muscle movements needed for articulation. The similarity to intoxication isn't coincidental. Alcohol directly affects cerebellar function, producing identical symptoms. Eye movements become slow and uncoordinated. Writing becomes difficult due to poor fine motor control. The correct answer is cerebellum, because damage to this structure specifically causes the coordination deficits characteristic of ataxia. 41. A patient with colour blindness has difficulty distinguishing red and green. Which genetic pattern explains transmission from carrier mother to affected son? A. Autosomal dominant, B. Autosomal recessive, C. X-linked recessive, D. Mitochondrial inheritance. Can you guess the answer? Correct answer, C. X-linked recessive. Explanation: option C is correct because colour blindness follows X-linked recessive inheritance, transmitted from carrier mothers to affected sons. Option A is incorrect because autosomal dominant inheritance would affect both sexes equally, not predominantly males. Option B is incorrect because autosomal recessive requires both parents to contribute alleles, not the mother-to-son pattern observed. Option D is incorrect because mitochondrial inheritance passes maternally to all children, not selectively affecting males. Colour blindness inheritance patterns reveal fundamental genetics principles. Red-green color blindness is caused by mutations in the OPN1MW gene located on the X chromosome. This X-linked recessive pattern means males need only one mutated copy to be affected, while females need two. A carrier mother has one normal and one mutated X chromosome. During reproduction, she passes either X to offspring. Sons receiving the mutated X will be colorblind since their Y chromosome from father carries no compensating gene. Daughters receiving the mutated X become carriers if the father's X is normal. This explains why colorblindness predominantly affects males, about 8% of males versus 0.5% of females. The pattern shows classic maternal transmission to sons. The correct answer is X-linked recessive, because the OPN1MW gene mutation on the X chromosome follows this inheritance pattern, transmitted from carrier mothers to affected sons. 42. A nurse monitors a patient receiving blood transfusion who develops rigors. Which medication should be administered first for this reaction? A. Acetaminophen. B. Diphenhydramine. C. Meperidine. D. Methylprednisolone. Do you know the answer? Correct answer, C. Meperidine. Explanation: option C is correct because meperidine is given first for transfusion-related rigors due to its anti-shivering properties beyond its analgesic effects provided. Option A is incorrect because acetaminophen treats fever but doesn't address the severe shaking rigors requiring immediate intervention needed. Option B is incorrect because diphenhydramine treats allergic reactions but isn't first line for the rigors component specifically occurring. Option D is incorrect because steroids are used for severe reactions, but meperidine addresses rigors more quickly and effectively. Managing transfusion reactions requires understanding the specific symptom mechanisms. During blood transfusions, rigors, severe shaking chills can occur as an immune response. These aren't simple shivers, but violent, uncontrollable shaking that's extremely distressing. The body releases inflammatory mediators causing this reaction. Meperidine has a unique property beyond pain relief. It's a potent anti-shivering agent. It works centrally to suppress the shivering response through NMDA receptor antagonism and monoamine reuptake inhibition. This anti-shivering effect occurs at doses much lower than needed for analgesia. Meperidine acts faster than other interventions for rigors. While acetaminophen treats fever and diphenhydramine addresses allergic components, neither stops the violent shaking. The correct answer is meperidine because its specific anti-shivering properties make it first-line treatment for transfusion-related rigors. 43. A patient with Hashimoto's thyroiditis initially presents with hyperthyroid symptoms before developing hypothyroidism. What antibody elevation confirms this diagnosis? A. TSH receptor. B. Thyroglobulin. C. Antinuclear. D. TPO antibodies. Can you guess the answer? Correct answer, D. TPO antibodies. Explanation: option D is correct because thyroid peroxidase antibody elevation is characteristic of Hashimoto's thyroiditis, indicating autoimmune attack on thyroid tissue occurring progressively. Option A is incorrect because TSH receptor antibodies are associated with Graves' disease causing hyperthyroidism, not Hashimoto's thyroiditis typically. Option B is incorrect because thyroglobulin antibodies may be elevated, but TPO antibodies are more specific for Hashimoto's diagnosis. Option C is incorrect because anti-nuclear antibodies indicate systemic autoimmune conditions like lupus, not thyroid-specific autoimmune disease present. Hashimoto's thyroiditis diagnosis relies on specific antibody patterns. This autoimmune condition involves immune attack on the thyroid gland. The thyroid peroxidase enzyme is crucial for thyroid hormone synthesis. In Hashimoto's, the immune system produces antibodies against this enzyme, TPO antibodies. These antibodies bind to thyroid peroxidase, disrupting hormone production and triggering inflammation. Initially, damaged thyroid cells release stored hormone, causing temporary hyperthyroidism. As destruction continues, the gland can't produce adequate hormones, leading to hypothyroidism. TPO antibody levels correlate with disease severity and progression risk. They're found in over 90% of Hashimoto's patients, making them highly specific diagnostic markers. While other antibodies like thyroglobulin may be present, TPO antibodies are the most sensitive and specific. The correct answer is TPO antibodies because their elevation is the characteristic finding confirming Hashimoto's thyroiditis diagnosis. 44. A patient with chronic kidney disease stage 4 has glomerular filtration rate of 20 milliliters per minute. What intervention becomes necessary as kidney function approaches end stage? A. Protein restriction. B. Dialysis preparation. C. Diuretic increase. D. Phosphate supplements. Do you know the answer? Correct answer, B. Dialysis preparation. Explanation: option B is correct because stage 4 chronic kidney disease with glomerular filtration rate 15. 29 requires preparation for renal replacement therapy as progression to end stage is likely. Option A is incorrect because while protein restriction may help, it doesn't address the imminent need for replacement therapy planning. Option C is incorrect because increasing diuretics may worsen kidney function and doesn't prepare for inevitable dialysis needs approaching. Option D is incorrect because phosphate restriction, not supplementation, is needed in advanced chronic kidney disease to prevent mineral bone disease. Chronic kidney disease stage 4 represents critical decision points in management. With GFR between 15-29 mmol/min, the kidneys retain less than 30% function. At this stage, uremic toxins accumulate, causing fatigue, nausea, and cognitive changes. Electrolyte imbalances become life-threatening. The kidneys can no longer maintain fluid balance, acid-base equilibrium, or produce adequate erythropoietin. Most importantly, progression to end-stage renal disease is now inevitable. Dialysis preparation must begin immediately, creating vascular access for hemodialysis or training for peritoneal dialysis takes months. Transplant evaluation should start simultaneously. Waiting until stage 5 leaves insufficient time for proper preparation. Forcing emergency dialysis starts with temporary catheters and higher complication rates. The correct answer is dialysis preparation, because stage 4 CKD requires immediate planning for renal replacement therapy before reaching end-stage disease. 45. A patient with rheumatoid arthritis cannot tolerate methotrexate. The rheumatologist prescribes hydroxychloroquine. What baseline examination is required? A. Pulmonary testing. B. Cardiac echo. C. Ophthalmologic exam. D. Nerve conduction. Can you guess the answer? Correct answer, C. Ophthalmologic exam. Explanation: option C is correct because hydroxychloroquine can cause retinal toxicity, so a baseline eye exam is needed for monitoring during treatment. Option A is incorrect because pulmonary function testing is not routinely required before starting hydroxychloroquine for rheumatoid arthritis. Option B is incorrect because a cardiac echo is not standard baseline testing, though an EKG might be considered for QT prolongation. Option D is incorrect because nerve conduction studies are not typically indicated, as hydroxychloroquine does not primarily cause peripheral neuropathy. Hydroxychloroquine therapy requires specific monitoring due to its unique toxicity profile. Originally an antimalarial, hydroxychloroquine treats rheumatoid arthritis through immunomodulation. However, it has a high affinity for melanin-containing tissues, particularly the retina. The drug accumulates in retinal pigment epithelium, potentially causing irreversible vision loss. This retinal toxicity is dose-dependent and duration-related, often developing after years of use. Early detection through baseline and regular ophthalmologic exams can prevent permanent damage. The examination includes visual field testing, optical coherence tomography, and fundus autofluorescence. Bullseye maculopathy is the classic finding. Once retinal damage occurs, it may progress even after stopping the medication. The correct answer is ophthalmologic exam because hydroxychloroquine's potential for irreversible retinal toxicity requires baseline eye examination and regular monitoring throughout treatment. 46. A patient develops neuroleptic malignant syndrome from antipsychotic medication. Which clinical finding occurs earliest in this life-threatening condition? A. Fever onset. B. Muscle rigidity. C. Mental changes. D. Blood pressure. Do you know the answer? Correct answer, A. Fever onset. Explanation: option A is correct because fever is often the initial symptom of neuroleptic malignant syndrome, preceding other manifestations such as muscle rigidity and altered mental status. Option B is incorrect because muscle rigidity usually appears after the onset of fever in neuroleptic malignant syndrome. Option C is incorrect because mental status changes generally manifest following fever as the condition progresses. Option D is incorrect because blood pressure changes, indicative of autonomic dysfunction, are typically a later finding in the progression of neuroleptic malignant syndrome. Recognizing neuroleptic malignant syndrome early saves lives. This rare but potentially fatal reaction to antipsychotics develops through excessive dopamine blockade in the hypothalamus and basal ganglia. The syndrome follows a typical progression pattern. Fever appears first, often exceeding 40 degrees Celsius. As the hypothalamic thermoregulation fails, this hypothermia precedes other symptoms by hours to days. Mental status changes follow: confusion, agitation, or catatonia. Then comes the characteristic lead pipe muscle rigidity from basal ganglia dysfunction. Finally, autonomic instability develops with blood pressure fluctuations, tachycardia, and diaphoresis. Laboratory findings include elevated creatine kinase from muscle breakdown. Early recognition when fever appears allows prompt discontinuation of the antipsychotic and supportive care. The correct answer is fever onset because it's typically the earliest sign of neuroleptic malignant syndrome preceding other manifestations. 47. A patient with sickle cell crisis receives intravenous fluids as initial treatment. What's the primary therapeutic goal of aggressive hydration? A. Pain reduction. B. Infection prevention. C. Hemoglobin increase. D. Viscosity decrease. Can you guess the answer? Correct answer, D. Viscosity decrease. Explanation: option D is correct because hydration decreases blood viscosity, improving flow through vessels and reducing sickling tendency that causes vaso-occlusive crisis symptoms. Option A is incorrect because while hydration may indirectly help pain, analgesics are the primary pain management intervention required. Option B is incorrect because hydration doesn't prevent infection. Prophylactic antibiotics serve this role in sickle cell management. Option C is incorrect because IV fluids dilute blood temporarily, but don't increase hemoglobin production or red cell mass. Sickle cell crisis management prioritizes addressing the fundamental pathophysiology. In vaso-occlusive crisis, sickled red blood cells become rigid and sticky, clumping together in small vessels. Blood viscosity, its thickness and flow resistance, plays a crucial role. Higher viscosity promotes more sickling and vascular occlusion. Dehydration concentrates the blood, increasing viscosity dramatically. Aggressive intravenous hydration dilutes the blood, reducing viscosity and improving flow through capillaries. This decreased viscosity helps prevent further sickling and allows sickled cells to revert to normal shape. Better blood flow reduces tissue ischemia and pain. While analgesics treat pain symptoms, hydration addresses the underlying mechanism. Studies show hydration reduces crisis duration and severity. The correct answer is viscosity decrease because IV hydration primarily works by reducing blood viscosity, improving flow, and decreasing sickling tendency. 48. A child with glucose 6-phosphate dehydrogenase deficiency must avoid certain medications. Which analgesic is safe for pain management? A. Aspirin, B. Acetaminophen, C. Ibuprofen, D. Naproxen. Do you know the answer? Correct answer, B. Acetaminophen. Explanation: option B is correct because acetaminophen is safe for G6PD deficiency as it doesn't cause oxidative stress triggering hemolytic crisis in affected patients. Option A is incorrect because aspirin can trigger hemolytic anemia in G6PD deficiency by causing oxidative stress to red cells. Option C is incorrect because while sometimes used cautiously, NSAIDs carry more risk than acetaminophen in G6PD deficiency. Option D is incorrect because naproxen, like other NSAIDs, may pose oxidative stress risks in G6PD deficient patients treated. G6PD deficiency requires careful medication selection to prevent hemolytic crisis. This genetic disorder reduces the enzyme that protects red blood cells from oxidative damage. Without sufficient G6PD, certain medications create oxidative stress that overwhelms the cell's defenses, causing hemolysis. Aspirin and most NSAIDs can trigger this oxidative stress through their metabolites. However, acetaminophen works through different pathways, primarily COX inhibition in the central nervous system without generating oxidative compounds. Acetaminophen doesn't stress the glutathione system or create reactive oxygen species that damage G6PD deficient cells. It's been used safely in G6PD deficiency for decades. Clinical guidelines consistently list acetaminophen as the safest analgesic option. The correct answer is acetaminophen because it provides effective pain relief without causing the oxidative stress that triggers hemolytic crisis in G6PD deficiency. 49. A patient with social anxiety disorder fails to respond to cognitive behavioral therapy alone. Which medication class is first-line pharmacotherapy? A. Benzodiazepines, B. Antipsychotics, C. SSRIs, D. Mood stabilizers. Can you guess the answer? Correct answer, C. SSRIs. Explanation: option C is correct because SSRIs are first-line medications for social anxiety disorder, providing sustained anxiety reduction without dependence risk of benzodiazepines. Option A is incorrect because benzodiazepines are reserved for short-term use due to dependence potential, not first-line chronic treatment. Option B is incorrect because antipsychotics are used for severe, refractory cases or comorbid conditions, not first-line social anxiety. Option D is incorrect because mood stabilizers treat bipolar disorder primarily, not indicated for uncomplicated social anxiety disorder management. Social anxiety disorder pharmacotherapy follows evidence-based hierarchies for optimal outcomes. When cognitive behavioral therapy alone proves insufficient, medication becomes necessary. SSRIs are established as first-line pharmacotherapy due to their favorable risk-benefit profile. They work by increasing serotonin availability in brain circuits regulating anxiety and social fear. SSRIs provide sustained anxiolytic effects without tolerance or dependence issues. They improve both anticipatory, anxiety and performance situations. Studies show 50 to 60% response rates with adequate trials. The medications also treat commonly comorbid depression. Unlike benzodiazepines offering only temporary relief with addiction risk, SSRIs provide lasting improvement. They're well tolerated with manageable side effects. Treatment requires 4-6 weeks for initial response, with full benefits at 12 weeks. The correct answer is SSRIs because they're the evidence-based first-line medications providing sustained anxiety reduction without dependence risk. 50. A patient with heart failure develops cough on ACE inhibitor therapy. Which medication class provides similar cardiovascular benefits without cough? A. ARBs, B. Beta blockers, C. Loop diuretics, D. Calcium blockers. Do you know the answer? Correct answer, A. ARBs. Explanation: option A is correct because angiotensin receptor blockers provide similar cardiovascular and renal benefits as ACE inhibitors without causing bradykinin-mediated cough. Option B is incorrect because beta blockers have different mechanisms and don't provide the same renoprotective benefits as ACE inhibitors. Option C is incorrect because loop diuretics manage fluid overload but don't provide the mortality benefits of RA's blockade. Option D is incorrect because calcium channel blockers lack the specific heart failure mortality benefits of ACE inhibitors or ARBs. ACE inhibitor cough requires switching to therapeutically equivalent alternatives. This dry, persistent cough affects 5 to 10% of ACE inhibitor users. It's caused by bradykinin accumulation. ACE normally breaks down bradykinin, so blocking ACE increases bradykinin levels in the lungs, triggering cough receptors. Angiotensin receptor blockers provide the solution. ARBs block angiotensin II at its receptor rather than preventing its formation. This achieves the same cardiovascular benefits: reduced blood pressure, decreased afterload, and renal protection. Crucially, ARBs don't affect bradykinin metabolism, eliminating the cough side effect. Studies show ARBs provide identical mortality benefits in heart failure. They offer the same renal protection in diabetes and chronic kidney disease. Switching from ACE to ARB maintains all therapeutic benefits while resolving the cough. The correct answer is ARBs because they provide equivalent cardiovascular and renal benefits without causing bradykinin-mediated cough. You have reached the end of our first question set. For the free complete exam preparation, visit our website link in the description, where you find thousands more practice questions and comprehensive study guides. Thanks for studying with us today. See you in the next video.